quickly, before we get into this podcast episode, I'm going to do a plug in here and say that I did record an episode and it's called Integrative Health Chiropractic with Dr. Wenchi Lee. And if you go back and find that episode, that might provide background information for those of you who aren't as aware, as informed of what chiropractic is. And even if you are, I think it's a really good episode in terms of providing a foundation for you all. With that said, enjoy this episode. Thank you. Hi, everyone. Welcome back to the Love is Healing podcast. We're an integrative mental health podcast that focuses on complex trauma treatment, sex addiction, functional medicine, frequency medicine, and many things holistic. Thanks for joining us again. Today we have a guest. This is Dr. Rick Murphy. He's a chiropractor and diagnostic specialist based in Idaho, graduate of the United States Naval Academy and a former US Navy submarine officer, where he worked in nuclear engineering and signals intelligence. That background shaped his systems-based approach into healthcare, focused on identifying and addressing the root causes behind chronic pain and illness. In his clinical work, he integrates applied kinesiology, functional medicine, and neuro-emotional technique to assess structural, biochemical, and emotional contributors to a patient's condition. In addition to his practice, he serves as an instructor with the Human Path, where he teaches botanical medicine and how to operate in resource-limited clinical environments. His work is centered on identifying what others miss and helping patients finally understand what's driving their symptoms. Thank you so much for joining us. I'm so happy to have you.
Yeah, it's great to be here.
Finding what others miss. That's your tagline, right?
Yep, finding what others miss in chronic pain and illness.
Yeah, yeah, yeah. Can you tell us a little bit about that?
Yeah, so I'm a chiropractor, and most people when they think of chiropractic, I think they are used to like a 5 minute visit. You just kind of roll in and maybe get adjusted, maybe like lay on like a traction table or something, and it's kind of in and out. And sometimes you don't really get a specific treatment. You get the same thing that the other guy before you got. You got the same thing that the other guy before you got. And that can work for a lot of people. But then there are people who are 20 adjustments in and they're like, I still hurt. My gut is still messed up. I still have like 3 a.m. wake ups and my blood sugar's a mess. And those are the kind of people that I see in in my practice who have these longstanding issues, and maybe they've been to a medical doctor and they're taking meds for it or whatever, but they still have the issue. Their symptoms are being managed, but the issue's not going away. So I operate on the principle of finding root cause, which does come from functional medicine, but you don't necessarily have to be a functional medicine practitioner to do that. Um, to me, that's just good healthcare, but it's different than the insurance model that we use globally in healthcare now. it's it's easier to look at the symptoms and say, okay, you have a headache, take some aspirin. The pain will go away and you won't feel your headache for a little bit. But are we really addressing the headache with that? I would say we're not. What's causing the headache? And so, me differentiating myself from the 30 other chiropractors in town who are doing what they're doing, which is great, and people need that. But how I'm different is I have a longer visit. People come in, they have these long-standing issues, and I ask, why are you having this issue? I do a longer history. I use applied kinesiology, which is muscle testing to address structural issues. I use neuroemotional technique to address some stress physiology that can be causing issues. And then I'm certified in functional medicine through Functional Medicine University. And I use those methods plus Lebowitz protocol, which is some energetic vial testing. It's not diagnostic, but it helps us see what the body needs at that point in time to help support the actual issue, not just address the headache or my neck hurts, will you adjust my neck? That may not even be the real issue.
Absolutely. I wholeheartedly agree with that approach. Thank you so much for voicing that.
Yeah, absolutely.
Perfect. So what led you to this type of work?
So this is gonna sound so so silly, but so growing up, I really got fascinated with like alchemy and potions. And so when I was doing my education at the Naval Academy and I was looking at what can I major in, I I literally was like, what is the closest thing I can do to making potions and like doing alchemy? So I majored in chemistry in undergrad, and that was really hard and a very good experience. It made it so that transitioning from the military to chiropractic school was a lot more simple because I had such a hard science background. I basically just had to take an anatomy class. But after graduating undergrad and doing my career with the military as a submarine officer and going into signals intelligence, I started feeling called another way to healthcare, and I started getting really interested in herbalism. So that's where I found the human path, which is a very interesting school. It's not just an herbalism school. It's run by Sam Coffman, who was a Green Beret medic and an herbalist, and then ended up getting a Master of Science in acupuncture and Oriental medicine. So he has a over 30 years of experience with herbs in addition to a more conventional medical background. And so he had a like survival school that also teaches herbs, that does like off-grid engineering and all these different things. So I got in with them, and along with the herbs, they also have some medical doctors on their teaching staff who do functional medicine. So I took a botanical functional medicine course, which I now help teach in that course. And that was my introduction to functional medicine. And it was just fascinating to me. It was like somebody finally connected the dots where I was like, I've been taking allergy medication since I started having allergies. And it's just expected that I'm going to be taking allergy meds every day until the day that I die for my allergies. And that's just the way it is. And no one really was like, oh, yeah, why are you having allergies? Like, do you have a large chemical burden? Your allergies started around the time that you got a mercury amalgam filling. Maybe those are related. No one, no one did that. And that's the kind of stuff that happens when you look at this like root cause type of paradigm with healthcare, where you're like, why is this being caused? Okay, why is that being caused? Why is that being caused? You're doing the like the 6 degrees of Kevin Bacon with your diagnosis and asking why until you get to the lowest common denominator, and then address that. And then all the upstream things can be freed and you experience greater health because of that. So that's kind of my roundabout journey to at least the functional medicine side of things.
Thank you for that. I love that. My mom was actually in the military also, in the Navy also, but in Mexico. And so she was a nurse, a surgical nurse, and I don't know, growing up with her and my dad, I just grew up with him having all these conversations and like asking the doctors, but why is this happening? I think she did a really great job of finding providers who would actually answer those questions. But as I grew up, was an adult, took charge of my own healthcare, that's something that I struggled to find in a lot of places, right? I have these headaches, they came out of nowhere. Why am I having them? Oh, I don't know. Just take some ibuprofen. Okay, but I don't care about the relief right now. I have a high pain tolerance, that's fine, but I want to find out why it's happening. Clearly something's wrong if it wasn't there and then it was, right? Very, very helpful. And I think you're correct in that it is like I mean, it's a big paradigm shift for people who aren't as aware, right?
Well, for a lot of people, they just don't know that's even available. We have this kind of mentality in Western healthcare where, um, for better and for worse, medical doctors who receive so much training in what they're doing and years of medical school and residency are put on a pedestal. And that can be good. Um, it can also have some detrimental side effects with society where people are not taking responsibility for their own health and they're relying solely on this medical doctor who is a human who can make mistakes. And because of the system that we're in, they're not able to spend the time required to really dive down and find what is the issue. So they're almost doing this like triage, just quick, what can I give you that's helpful? And taking away someone's pain temporarily is helpful, but some people need deeper care. And unfortunately, just the way that our system works right now, it is difficult to find that care.
That makes sense. Shifting gears slightly, can you tell us a little bit about your mentor? He was trained in Western medicine and also in traditional Chinese medicine. How did that shape you? What was that experience like?
He's got some really cool stories and upbringing. So he grew up as the child of someone who was out doing like research in the summer on herbs, land, and stuff like that. So he spent so much time outside growing up, just interacting with plants and like almost having a feral type of childhood, which is really awesome. Most of us don't have that opportunity nowadays. He started life having this connection with nature that a lot of us don't have now, and learning about those herbs. When he was going through his special forces qualification course as a medic, he was out mountain biking and got in an accident, and he had an avulsion fracture on his thumb. That's where part of the bone is pulled off of the bone by the muscle tendon. His next phase that he was going through was a goat lab, where he was learning to do medical procedures on goats to learn how to be a special forces. And it required a lot of hand strength. Fortunately, he had a little bit of a gap where he was able to work on his hand and not like need it. He went to medical, and the doctor there told him like, "Hey, you need to be in a cast. You're gonna roll to the next class. Like, you're not gonna be able to do Go Lab or whatever because you're gonna be in a cast." And he's like, "I'm not gonna do that. That's dumb. I'm gonna do something else." And the medical doctor, who was also a military officer because it was on base, was like, "You're stupid for doing this. Like, I'm gonna make sure that you get written up, and like, I don't want to see you back here like, get out of my face, get out of my sight. That day, he went and got a couple of herbs from the local shop. And I want to say that it was comfrey and bone set. He applied those with like just a wet poultice, and he was changing out his poultice every couple hours. It was like a big deal because herbs at the time, he didn't want people to think that he had marijuana or something. So you're not allowed to have that service. Times have changed. Like this was like the 70s. Getting caught with that in the service was a really big deal. Doing that for 2 weeks. By the time that he got to Goat Lab, he had enough strength in his hand that he was able to actually perform, and he did not roll and lose progress in his training. That was his first like really impactful experience using herbs. From there, he started incorporating herbs in his kit for his team. So they'd be out in the field, and he'd have different herbs that he could use. And people got curious because he was taking the herbs and really healthy. He never got sick, but his teammates did. So that's kind of his general background. Herbalism is not a licensed profession in the United States. It's kind of this like no man's land as far as who does it and are they qualified. It's more traditional. So part of the issue that he was running into, even though he had so much experience once he got out, the FDA, um, there's always that like semantic battle of, oh, are you treating disease? Are you diagnosing people? Are you claiming to treat disease with this? Are you claiming to cure disease? Because those are all medical words. If you're a medical doctor, then you're allowed to treat, diagnose, and cure. But as an unlicensed herbalist, that's not allowed. So you have to do this dance. He got kind of tired of doing that. So that was part of the reason why he decided to study TCM more deeply, was to have a healthcare license that included herbs. I'm really fortunate in that the state of Idaho is very open for chiropractors and as far as scope of practice, and allows me to use herbs to address the human condition. And so with what I've learned and continue to learn from my mentors, Sam Coffman being one of them, I am incorporating herbs in the healthcare that I do for my clients, patients.
That's really neat. I love that you have that overlap of being in the service together and then that love for potions of sorts. I think that's great. But then also the respect for the field and medicine too. I love that. But then also like a mind for genuine problem solving.
Yeah. Western herbalism is where I gravitate currently, and I think that that's just a feature of my training. Chiropractors are a little more on the like the woo-woo side of things, I guess you could say, but we still have a very Western physiology-based education that's designed to mirror the medical model in a lot of ways. The deep anatomy that we learn, we just don't learn the pharmaceutical pathways that a medical doctor does because we don't prescribe pharmaceuticals as chiropractors. The TCM perspective, traditional Chinese medicine or herbs, is quite different. And you can look through the like acupuncture meridian system, and they do tongue diagnosing. It's not called humors, in more of a Greek term with like traditional Greek medicine, but traditional Chinese medicine will say you have like a yin excess or yin deficiency, or yang excess or yang deficiency, and or hot or cold or dry or damp, these different kind of energetic features. So one of the things that my mentor noticed when he was starting off his TCM journey, he was going from the Western physiology mindset that he and I both started in. And he's like, yeah, when I'm trying to do like stuff with hormones with herbs, and it's like playing whack-a-mole. Like it's kind of tough. And he talked with one of his TCM mentors, like someone he really respected, and she said, "Oh yeah, just, do this." And she treated it like it was low-hanging fruit. Immediately, he's like, antennas up, like, I'm ready to listen to whatever you have to say about this because I've been dealing with this clinically for years and it's been a struggle. And you're telling me that it's like low hanging fruit? Like I've got to learn whatever it is you're teaching. That's another reason why he ended up kind of doing the TCM thing. It's amazing to watch him.
I love that. What can you share with us about applied kinesiology, what that is, and also maybe the triad of health?
Okay. Yeah, there's a lot of questions there. So a lot of people, when they hear applied kinesiology, they'll fixate on the kinesiology word. Kinesiology is basically like the study of movement in the body. Applied kinesiology is a chiropractic technique. It's not just chiropractors who use it. In Europe, it's actually more common for medical doctors to use applied kinesiology than chiropractors. It came to be based on the work of George Goodheart in the mid 20th century. He was an avid reader and looked at just all these different books from different disciplines and started combining stuff to do exactly what I am also trying to do in my practice, which is find the root cause of what's going on. And the first major breakthrough for him was he was helping this guy who wanted to work in a factory, but he had a scapular flare. So his shoulder would wink because his serratus anterior muscle was not activated. Didn't really know that at the time, but that's what kind of the root cause was. So after a number of different visits, Dr. Goodhart's kind of stewing on things and helped some other issues with him. I think it might have even been his thyroid. I don't remember exactly. Dr. Goodhart found these nodules kind of on his ribs over the serratus muscle. And he said they felt like BBs under a slab of bacon. And he did what we now call origin insertion technique and pressed on the nodules, and the gentleman's serratus anterior then started working, and he no longer had the scapular winging, which meant that he could then seek employment because he didn't have that like disability anymore. Dr. Goodhart, thought maybe it was a fluke. So he was like, yeah, why don't you come in and we can check on I think it was his like looking at his hair loss because of like thyroid stuff. It's like, come on in, we'll check on your thyroid stuff or whatever. So the guy's like, oh, okay. And checked and he didn't have the scapular winging or whatever, just wanted to have kind of an excuse to do that. But that was kind of the birth of applied kinesiology. The other thing that happens with applied kinesiology is people will associate it with muscle testing, which is not wrong, but applied kinesiology uses muscle testing, but muscle testing and applied kinesiology are not one and the same. There are lots of different techniques that use muscle testing. Neuroemotional technique, for example. I've also been trained a little bit in Nam Vajrapad's allergy elimination technique, and that also uses muscle testing. It's a very standard kind of thing for the alternative health circles to use muscle testing as a form of not diagnosis per se, but as a way of figuring out like what direction the treatment is going to go. For applied kinesiology, strictly, we're using different muscle tests for specific muscles rather than just a like straight arm muscle test, or you'll see people do like a finger lock thing and checking like tension. Um, yeah, or the finger for like self-testing. Yep, there's different ways to do that. The type of muscle testing that we're doing in applied kinesiology has been scientifically validated when it is done properly. There are absolutely 100% incorrect ways that have not been scientifically validated. If you are trying to use it as like a lie detector test or as a divining rod of some kind, those have not been scientifically validated. That's not what we're doing with applied kinesiology. What I do, I will find a muscle that should be strong and ends up having a weakness, just like with Dr. Goodhart's story, where there was a physical symptom of scapular winging, and there was a weak muscle associated with that. We would test that muscle, and then there are different reflex points on the body, acupuncture meridians on the body that are associated with that muscle. And we can check and see which one of those things is out of balance right now. Address that, and then it makes that muscle happy. And that can be causing body pain. It can be causing some organ dysfunction. There's many different things that could be associated with that muscle. There could be a nutrition deficiency. There could be an emotional or like a stress event that's causing an issue in that muscle. So applied kinesiology gives me an entry point where I can then address those issues systematically to help someone achieve greater health.
It's a very tailored approach. It really attunes you to the client or the patient and their needs. And it's their body letting you know what it is that it needs rather than a one size fits all approach. Yes.
Yeah, absolutely. I don't even know how you would do a one size fits all approach with applied kinesiology, to be honest, because you're constantly going through and testing range of motion. Does this still hurt? Is the muscle changing? Ideally, if you're testing nutrition, you're having them taste the nutrition to get that gustatory response. Is that giving the body what it needs? Do you actually need more vitamin C? Do you need more vitamin B? Like all of those things. I have no idea how you would like do that as a one size fits all approach. It'd be completely wrong, in my opinion. I'm just going to give everyone B vitamins. We know from the different genetic SNPs that people have had with trouble methylating that if you're given somebody cyanocobalamin, which is B12, versus methylcobalamin, which is also B12, but they're different forms, people react differently to them. And you can test with using the muscle test and the gustatory response which one of those is going to be better for them. You can also look at their labs, which is something that I do as well to give that extra layer of diagnostic rigor when it's needed. Somebody's not getting better. We're going to do what we need to make sure that we are finding what others miss in chronic pain and illness.
That makes a lot of sense. Thank you. Essentially, applied kinesiology is you use the body's muscles to figure out what's wrong or the fact that something is wrong. The body's like able to, it's safe enough, right? Because that's a component as well to for the body to be able to feel safe enough. Like there's a lot of stabilization. Let's backtrack, but that has to happen, right? The nervous system has to feel safe enough, stabilized enough to be able to start healing different things because like even if there are underlying infections or nutritional deficiencies, etc., if the body isn't strong enough, the nervous system isn't strong enough to be able to handle it, then you can't. I think that's the part where it's tailored. Because let's say two people have rheumatoid arthritis. And even though you're not treating the condition, you're still treating the person. Maybe they're having similar symptoms, but they have different nervous systems. Maybe one of them gets to do yoga and like chill all day and does a lot of relaxing things. The other one leads a really chronically stressful lifestyle. They show up in your office, they both want you to treat them. You might be doing really different work depending on the state of the nervous system and what the nervous system can handle in terms of like being able to address the stressors that are the infections or the deficiencies?
Yeah, that's a really good question and a really good example. Just because two people have the same diagnosis does not mean that they need the exact same care. This is one of the frustrations that I have with evidence-based healthcare. There are three pillars for evidence-based healthcare. One of them is best clinical evidence, which is research. That gets way overblown. In order to do a good like evidence-based research experiment, we have to remove a whole bunch of variables and look at things in isolation. But people are not isolated variables. They have a lot of things going on in their lives. So the other two principles of evidence-based healthcare are patient preference and clinical judgment or clinical expertise. Those need to be applied. We can't just look at this research and be like, oh, well, if you have rheumatoid arthritis, then therefore that's an autoimmune condition and we're going to give you an immune suppressant. Period. That's your treatment. How about like, hey, where is the rheumatoid arthritis affecting your body? Is it affecting your hands? I have somebody I know who it's not his hands, it's his hips. His hips are what are really kind of affected by his variety of rheumatoid arthritis in his body. So two people have the same diagnosis, but they may need different treatments. And every time that someone is laying on a table in front of me and they're in my office, even if it's the same person, their body is in a different state than the last time that I saw them. With rheumatoid, are they having a flare up currently? That's going to dramatically alter the way that I am working with their body that day because they are actively flaring. They're inflamed. I'm not going to go and rock one of their rheumatoid inflamed joints while they're having a flare up. That's a bad idea. It's going to overstimulate their nervous system, just like you were saying. The beauty of these diagnostic protocols with applied kinesiology and any chiropractic type treatment where they're actually doing chiropractic diagnosis. Applied kinesiology is not the only one. But if you're not just looking at the neck and being like, oh, the neck hurts, insurance says because their neck hurts and they're having trouble moving it, I can adjust it. That's not good healthcare. That's insurance payer healthcare. But actually going through and saying, what does this person in front of me need right now? That is the kind of healthcare, the individualized healthcare that's really helpful and is honestly missing in our society right
Absolutely. Thank you for that. Plenty of examples that I can think of as well. I just want to give an honorable mention to mental health here. I think depression, and I think now that I have a bit of this lens, I apply to kinesiology, a little bit of herbs, a little bit of functional medicine. And it's like, okay, this person in front of me is here. They're trying to get treatment for mental health care. And let's say they have depression and they have PTSD. It's like, okay, well, are you out of the situations that are causing the PTSD or the depression? And then their lifestyle factors like, are you at a job that you hate? Because that's an obvious low-hanging fruit, as you said. Then how is your nutrition, your blood sugar? Are you sleeping? Like, are you eating foods that you're sensitive to in this moment that are causing you to be extra anxious or extra depressed? How's your inflammation? All these other things too. This is the meat of actually treating people through more of an integrative approach and a more tailored approach, looking at all these factors and not just saying, you have depression. Great. Let's just talk about it and let's talk about how you cannot be depressed and let's change your thoughts. That's not how it works. So yeah, thank you for that.
now. Right. And from a more conventional medical perspective, you're depressed, let's give you an SSRI. Why are you depressed? Maybe you have mold in your home, and that mold is making you anxious and depressed. So, what we really need to do is address the fact that you have mold spores in your system, and we need to address the mold that's in your home and get you out of the mold situation. Either get rid of the mold or, move you. An SSRI might help with some symptoms, but you're going to be dependent on the SSRI because you're not addressing the actual cause of the depression.
Absolutely. Thinking also of like antibiotics. Yes, it treats things and sometimes we need them. Sometimes it is a life-saving measure. At the same time, it can contribute to depression as well if you have a really big fungal overgrowth as a result of like killing off a lot of the bacteria. Lots of different causes that we can get into. And to go back to the triad of health, the triad of health is the biochemical, the nutritional, and the structural. We're talking a little bit about these things here in these examples. Let's go into the emotional component a bit more. You are certified in neuro-emotional technique. You got certified this year.
Yeah,
Exciting. Congrats.
after several years of work.
Oh, yeah. Good.
Yeah,
NET is really complex. Have you been to the next training for
I
NET?
have.
Okay,
It
so
is chock full of techniques. It's a very dense. So
I think did you go in August? I feel like I saw you there.
I think I might have gone. I don't exactly remember. I do know that it was in Carlsbad.
Yes. A
Yeah.
nice place. Tell us a little bit about NET. NET is not therapy. You can use it in psychotherapy. You can incorporate it into a lot of different things. NET has different organ points that you can look into. As a chiropractor, you can give adjustments to help correct that. What is your description of what NET is? Why is it beneficial? Why did you invest all this time and money to learn it?
Part of the reason that I branched out and went into NET rather than just the standard rack 'em crack 'em chiropractic thing is actually because of a family member of mine that I see every day. And she always has had this point on her ribs that was kind of painful. And she was getting adjusted regularly. I worked in a chiropractic office, and so she would come in regularly and get adjusted, and that point just kept coming back. And so when I was in school, I started this search for obviously just adjusting the thing that kind of hurts doesn't work all the time. Why not? What do I need to learn to make it so that I can address whatever's going on? So that was what kind of got me into applied kinesiology. And the doctor at Parker University, where I went to school, who taught applied kinesiology, it's Bob Wilborn, is a certified NET instructor, actually. I don't think that he's taught in a while, but he's on their website and on their list. He showed us a demo of neuroemotional technique and helped one of my friends with shoulder pain and went back, and it was this event from her childhood. She had been bullied, and that was what came up for her shoulder. And I was immediately fascinated by that. Like, you're telling me that what we just kind of learned in passing, the university has really gone away from a lot of the chiropractic philosophy. It's uh, really focusing now on evidence-based physiotherapy type stuff rather than chiropractic. And so we had just learned these things in passing of what causes a chiropractic. We call it a subluxation. You could call it a lesion, stuck joint, whatever you kind of want to call it. D.D. Palmer, the originator of chiropractic, said that it was modern phraseology, thoughts, traumas, and toxins. Thoughts is essentially our stressors, our emotions. And that's what neuroemotional technique was addressing. So it was fascinating to me to look at this and be like, okay, so you're telling me that I can have pain in my body because of a stressor. And not only does that happen, but I can do something about it in a systematic way that I know is going to be helpful. I can also support that person with homeopathy, with some remedies that neuroemotional technique sells to help them clear out the different like waste products when we deal with that emotion. Absolutely fascinating. So I've loved going to NET seminars and going through the certification process. NET with certainty is kind of their tagline. And I would say 100% the certification process does get you NET with certainty. It's been really cool.
Absolutely. Thank you for that. Yeah. It reminds me of Dr. Bessel van der Kolk's book, The Body Keeps the Score, which complex trauma specialist, psychotherapist, that's what we would call the trauma Bible. And I read it when I was a very baby therapist about 10 years ago. And yeah, so now people are starting to talk about this concept of psychosomatics. So then I'm thinking about trauma, right? Because I think about the typical patient that you might have, maybe. Maybe a typical patient that would go into a chiropractic office might be like, oh yeah, hey, I'm having this shoulder pain. And then they're like, cool, can you adjust me or whatever? Or like, I have this back pain, can you fix my spine? Like you said, like you could have someone who has like a chronic thing, let's say, let's go with the back. And it's just there, it's just there, it's just there. There are other components to it. And maybe it's like, it keeps reoccurring. They're fine for a second. And then it's like, here you are, 14, 15, 20 treatments later, and it's still that same issue. Like you said, is it toxins? Is it something else? Is it emotional? A lot of people who have back issues, in my experience, I'll look at it spiritually and emotionally. It could be something in the sacral chakra. Maybe they have a lot of stressors around money. Maybe they feel like they're breaking their back to go to work. And yes, it is metaphorical. And at the same time, it does turn into a physical manifestation of that. Neuroemotional techniques. Let's say, it's just a demo. Let's say my shoulder's hurting, which it is. Let's say my shoulder's hurting and I'm like, hey, can you help me with my shoulder? I guess, how would you treat that? Can we role play it for the audience?
Oh yeah, sure. You might ask some questions about limiting activity, like what are you able to do, not do, do a little bit of range of motion. Might actually check the muscles around the shoulder. There are a lot of them. The shoulder's a very mobile joint. It's stabilized by the muscles, not by the joint so much. So probably the most unstable joint in the body, frankly. So I see a lot of shoulder issues. But that's just kind of like baseline to see, are we meaningfully changing stuff after the fact? We might also get like a pain scale. Be like, okay, right now, just sitting there on a scale of 1 to 10, can you rate your shoulder pain?
6.
6. Okay. So pretty high up there on for just sitting there and not doing any activity. So then we would do some muscle testing. So I would probably use the other arm, the one that's not injured, do some testing to see, are you strong? Check your polarity point to see if we are testable and compatible in that moment. We can connect and actually talk. Then I would touch your shoulder just to make it a little bit easier since your hand is being tested and see, is that muscle strong or is that muscle weak? Just as a baseline. To check for emotionality, we would have you touch the emotional points on your forehead. So I would be touching your shoulder, you would be touching the emotional points, and then test. Does that change the muscle test? There are a couple different things that we can check for emotionality and to, get fancy. And you know these too because you're certified too. But um, basically, we're looking for a change in the muscle test. And what that change signals is a change in neurology where the brain is saying there is physiologically an emotion that is affecting this part of my body. They are related. In the neuro-emotional technique parlance, we would say that there is a neuro-emotional complex there, which then means that we can do neuro-emotional technique to help that area. And based on the legwork that we did previously with, range of motion check and pain and tell me about your activities and everything, we would then do the treatment, neuroemotional technique, address whatever emotionality is there, and then after the fact, do those checks again. I've seen wild and immediate changes with like I can move my shoulder like this and I'm, leaning, trying to recruit my traps, trying to get it to work. Now, like I get to like here. I've seen people basically throw their shoulder up, whereas previously they had like a borderline frozen shoulder. There's some amazing stuff that can happen with NET. Sometimes it's like one visit, sometimes it takes a couple times, right? We're humans, we're complicated, we have layers for better and for worse, but it's a very amazing tool. Integrates homeopathy. It can also look at nutrition, and practitioners who are licensed to do so can do those things. And also, as you were mentioning, adjustments or things physically. Not everyone is licensed to do that. I'm fortunate that I have a license that allows me to do that. But like you also said, it's not a replacement for therapy. So just because I'm helping to clear something out and make it easier to digest does not mean that someone would not also benefit from actually doing some cognitive behavioral therapy or some other kind of therapy.
Thank you for that. I want to make a brief mention, like, it's a lot. For example, I mean, I grew up with complex trauma, no stressors, and I'm married to an active duty member, and like, it's a lot. Life is a lot. COVID happened. We're post-COVID. Like, life is a lot. And I just kind of follow my intuition with like what it is that I need to do. For example, I just so happened to message a friend who's going to be doing NET on me later today, and I'm grateful for that. But like, I was guided to like I started noticing like my fascia is really tight. So then I started working on that. And then even to include last night. So I was working on releasing my fascia and I had a massage yesterday too with like cupping and that was helpful, but it released so much rage and anger. But I knew that it was my body releasing rather than like I feel angry. It's like, oh, this is something that's stored in my body. And that's a slight nuance. And to anybody listening who has complex trauma, like if you needed to hear that, I think that's helpful to notice and to like start stepping into noticing these different things. But it's like, well, obviously there's a lot of emotional components to that, so that's helpful. But yeah, I love it. It sounds like you, in particular with your practice, there's just so much that you offer. And I love that I mean, we didn't even get a chance to really talk about the functional medicine, but essentially functional medicine is like how you function, right? And like making sure that like everything is functioning the way that it needs to function in your body. You have the nutritional component of things, you have the emotional components through the NET, you have some of the herb stuff, you have some of the Lebowitz technique. I know you're gonna go to another Lebowitz technique training, which is really exciting because I love that approach, honestly. And it's an applied kinesiology approach. And I see that. And I think really what we're trying to highlight is through these different modalities, we're able to find things that others miss because you're not just thinking A plus B equals C. You're thinking, oh, there's this person. Let me see what I can find. And it's like a constant discovery, is it, as you interact with patients?
Yeah, I've been described as a detective in the body because of my background in hard science, and I studied nuclear engineering for my first part of the Navy because all submarine officers are nuclear trained. Went from that to the intelligence field where it's literally piecing together information and then applying information. Because information applied is intelligence. It's not intelligence, it's not useful unless the information is applied. So that's the way that I operate clinically is I'm like, okay, you have this problem. What are some things that could potentially be involved with that problem? There are patterns, but like we were talking about with the rheumatoid arthritis example, just because you have a diagnosis doesn't mean that you're going to be the same as everyone else who has that diagnosis. You are your own unique person. And so I need to approach it from a standpoint of you are a unique individual. And from today versus the next time I see you, you are going to be another unique individual. So every time someone comes into my office, they get a screening with applied kinesiology and muscle testing. What are you ready to receive today that will be the most impactful thing for
Absolutely. I love this. We've touched on very amazing topics today. Dr. Murphy, what final words do you have for our audience as we sign off?
It's been wonderful to talk with you and hope that people who need to hear what we have said today are led to this conversation have been able to receive what we've said. If there's like one thing that I could say, it's that you are not your diagnosis. You are a unique person and we can help you. You don't have to be stuck.
I love that. Thank you for that. Folks, we'll have more information in the show notes. If you're interested in working with Dr. Murphy, he can be found in Idaho Falls, Idaho at Origin Spine and Wellness. Thank you so much for listening and see you next time.